Hi, Bill Kristol here with Sunday Bulwark. I'm very pleased to be joined live today by Bree Fram, Colonel in the United States Air Force. I guess now maybe in Space Command. Is that right? Did I
Space
correct
Force
that?
now. So I've
Space
been in the
Force. I can't
Space
even.
Force for the past 4 years. Yeah.
I can't even adjust to these new names. I'm sure that was true earlier in the Air Force days, right? Where it was like the U.S. Army Air Force or something, and they said, no, it's an
Army
independent.
Air Corps, then the
It's
Air Force.
it's an independent command. Bree's had a very distinguished 2 decades of service in Iraq and many other places, and many different roles in the Air Force. You're an engineer, and but now you are leaving, I guess, the military on volunteer, and not as you would have, not as you wished to, and you were a victim of the, I guess it's an executive order, or anyway, the diktat from on high that uh, banning or separating any transgender service member from serving. So tell me a little bit. I'm curious about just your history in the military, and then let's get to the current situation.
Yeah, it is strange now being on administrative leave, just waiting for the final I's to be crossed and the T's to be dotted, as I hope to be allowed to retire at the end of the year. But right now, doing nothing, though I'm still active service member subject to the UCMJ. So it's important to note that I'm here with you in my personal
Right.
capacity, and my views do not necessarily reflect those of the Department of Defense or the United States government, which will probably be quite obvious as we talk through this. But just the very quick snapshot of my career, yes, I've been in over 22 and a half years. I graduated from college in 2001 with no intention of serving, but we were attacked. And that was my turn to give back, to be part of something greater than myself, to defend those freedoms and opportunities that men like my grandfathers, who were heroes as immigrants and refugees that fought in World War II, did amazing things. I wanted to carry on that legacy and to help defend our nation. And I served 18 years in the Air Force before switching over to the Space Force, and was afforded incredible opportunities to include coming out as trans in 2016 after 13 years of service, and serving the rest of my career authentically. And it was such a gift. And I hope we get into some of that, some amazing kind of bookends to my authentic service, and what that meant about the changing military, and what it means, what our country is going through right now. As you mentioned, particularly for us, starting off with that executive order, which was prioritizing military excellence and readiness.
Wow. I'm sorry, I lost some contact here for a minute, but I think I know your history there. Uh, so what? I mean, give me. I'm curious about your. Maybe you mentioned this just now. As I say, I missed about half a minute of what you were saying, but the um, the experience of coming out in 2016. You've written about that, I believe, and spoken about that. And just how did that go? How did the military treat you? How did your colleagues take it? What lessons did we learn from that?
It was an experience that shocked me, because I was in my first tour at the Pentagon. I was a major at the time, and I knew the Secretary of Defense was going to make the announcement that trans people could serve openly. And when he finished speaking, I had an email ready to go to my colleagues and a Facebook post coming out to the world. Because prior to that, had anyone known and that word got back to someone, I would have lost my career, at that time 13 years, for something that had nothing to do with my ability to serve. But he wrapped up, said, as of now, trans folks can serve openly. I was a little afraid, so I paused for a moment and then hit send, hit post, and ran away. Went to the gym buried underneath the Pentagon, got on the elliptical machine, and I went nowhere faster than I'd ever gone anywhere in my life, thinking, how is my life going to be different? But when I got back to my desk, I sat down, and one by one, my colleagues walked over to me, shook my hand, and said, "It's an honor to serve with you." And I was floored, because the honor was mine. I served with incredible people, and we knew instinctively that we had one another's back when the chips were down, and we had to work incredibly hard. So to be able to do that openly, and instead of spending time and energy protecting my identity, I could rededicate that into the mission and the relationships around me. And it made me a better leader, a better friend, a better service member. And I think when we take that all the way to its conclusion, which is during my last week, I was back again. I'm serving as the Pentagon, now as a colonel. And I think it's important to note that, when I would walk into a room, the first thing people see is not that I'm trans. They see a colonel. They see my uniform. They see what that represents, the responsibility that it conveys. And I'm going to these final meetings knowing that the end is coming, where I'm being placed on administrative leave. And I sit in a meeting with a bunch of senior admirals and generals on the joint staff. And at the end of the meeting, they go around the room and I'm the last one to talk. And they say, anything from you, Space Force? Like, yes, here's one work-related update. And also, I'm sorry, this is going to be my last meeting. It's an unexpected departure. I do not know when we're going to have a replacement. And the officer sitting next to me says, oh, why? Where are you going? What assignment did you get? I'm like, well, I'm sorry, I don't meet this administration's standards for military excellence and readiness. And it took a moment as kind of faces in the room dropped, and that scene from 2016 repeated. But this time it was admirals and generals getting up, walking over, and with sadness in the twinge of past tense that was in the words, they said, it's been an honor to serve with you. And I walked out of that room with tears in my eyes, departing the Pentagon for the final time several days later, wearing my uniform.
It's amazing. And in the, I guess what would have been 8+ years that you served from 2016 to 2025, were there issues, problems? Was it pretty, I mean, how did it just go sort of day to day, week to week for you?
None whatsoever. No issues. I believe I became a better officer and a better leader. I had the full support of the people that I had the privilege of working for. My colleagues were fantastic. And the people that I had the honor of lead were wonderful. In fact, the day I finally came to the office as myself, my team had changed the nameplate on my door. We had cookies in my office and took a bunch of pictures together with everyone smiling. It was phenomenal. And I think that experience was widely replicated throughout the military, because what do we care about? Do we look to our left? We look to our right. Do you have my back? Are you here for the right reasons? And we have proved over and over again that we're capable of accomplishing the mission. And so we were trusted to do that. And again, I think people really became stronger at what they did, because all we were doing was reaching for our best selves. That's what transition was for us. It was being the best version of ourselves we could be and rededicating that into the relationships we had and the mission in front of us.
I want to get to the present and the, I guess, future now and in a minute, and sort of how others in your situation, what the situation is more broadly in the military and then beyond the military, obviously, and the pretty widespread assault, I would say, on trans folks by this second Trump term. But of course, you served through the first Trump term, and there were one or two moments, I believe, where Trump said he was going to try to separate people who had transitioned and so forth, or who were trans, or just what was that? I mean, how different was that? I mean, how difficult was that? How worried? How seriously did people take that? As I recall, Mattis stepped up pretty quickly to slap that down. But anyway, you were there. You would remember it so well.
It was pretty wild, and there are some significant differences between what happened the first time around and what's happening this time. In 2017, first of all, it was a complete shock. I was, in fact, on my last day of leave with some high school friends. We were gathered around a lake in northern Minnesota and enjoying a beautiful morning, and my phone started blowing up. I'm like, oh my God, what happened? Because this was the time when we were arguing about whose button was bigger to launch nuclear missiles. And I'm like, are we going to war with North Korea? Is that what's happening? But no, it turns out the president had tweeted that morning that there was something the United States government could neither accept nor allow. And then after a 10-minute pause where everyone wondered, is it the North Koreans? Are we going to war? Well, no, it's just that trans people are such a burden and a disruption on the military that we can't possibly have them serving. So first you're like, is a tweet an order? Is this policy? What do we do? And it was the first time where we kind of had to formulate what can we do? And the only answer was lace up our boots, go to work, and accomplish the mission that we've been given. Prove again and again that we belong. And we did so. Public opinion changed dramatically all of a sudden because of the 2 months after that. We got the media spotlight that showed us accomplishing the mission here at home and around the world. But that tweet did eventually turn into policy. It's challenged by the courts. The Supreme Court allows it to go into effect. But in essence, it was a ban. It made it so that no new trans people could come into the military, and no one who hadn't come out while that previous policy was in place would be allowed to transition or receive care. So for me and about 1,600 others, there was an exemption that allowed us to continue serving. What's so dramatically different this time around is that it's both that ban component and a purge. And instead of being
the ban, if I could, is
yeah.
This is, by the time it gets to the courts, this is what, 2019-ish, I suppose, and then the Biden administration reverses that. Am I right? So
you are exactly right. The ban itself lasted only about a year before Biden administration reverses it. You have thousands more trans service members out at this point, where you see, instead of this bolt out of the blue, now it's like a hurricane forming offshore, and you're just wondering, how big is it going to be and where is it going to hit? Because there's $200 million spent on anti-trans advertising in the last couple of weeks of the campaign. Even before inauguration, the president says he's going to end the transgender lunacy on day one. And that hurricane really arrived in that executive order prioritizing military excellence and readiness. And there are some things in it that make me laugh. And one of those, in general, is the argument that we are too strong for sports, but too weak for the military. But the executive order was really an attack on our character. It said that we were undisciplined, dishonorable liars who lack the humility required for military service. And it's the humility piece that really gets me, because I'd ask anyone who's listening, like, have you ever met a pilot? And have you ever met a military pilot? Because the first will tell you they're a pilot in the first 10 seconds they talk to you. And the military pilots will tell you they are the greatest pilot in the world in that 10 seconds. And is that humility? No, but do we want them to be humble? Absolutely not. If you are going to launch yourself at the tip of the spear in $100 million aircraft, I want you to be a badass. And they are. So it's just funny that was one of the arguments, that we're not humble enough. But in many aspects, I'd argue that we are, because we are the people that are humble enough to put on the cloth of our nation, to follow the orders of those appointed above us and the president, and to carry out missions that are incredibly dangerous at times. And we are willing to make that sacrifice on behalf of others.
I guess it's striking that they went to that argument, if you want to call it an argument, or set of assertions that they thought, I suppose, might be more defensible in court, because how do you falsify something like that? It's just a, claim about people's generic claim about people's character, a certain group's character, I guess. It's not, but what struck me at the time just is it's not based on any claim even of evidence. We've done studies, or studies have shown that it's very disruptive to, group cohesion or unit cohesion. I mean, there are things one could have said, and that were said in the past, actually, against integrating various groups, all the way back to African Americans, and way back, and pretty way back, and of course women and gays and so forth. But they didn't even try to make the kind of, did they? I mean, the pseudo military readiness arguments. It is in that way just a pure assault on trans people as trans people.
Yeah, the same arguments were made, as you mentioned, as were levied against African Americans, against women, against lesbians, gays, and bisexuals. And every time those groups proved them false, just as trans service members have over these 9 years of us serving openly and authentically. And there are so many disconnects between any of the logic presented by the government that when these policies did become challenged in court again, you had 2 district court judges basically flatly rejecting them on the face of it, saying there is nothing here but animus. It is in fact the service records of the members that were the plaintiffs that were Exhibit A as to why these claims were provably false. And even then, though, despite attacking character based on transgender status, the government made it about gender dysphoria, which is a medical condition that all of us were required by the government to have on our records should we need to access transition within the military. It was forced upon all of us. And then they say, well, it's a medical condition we're kicking you out over, but we're going to take you to an administrative separation board with no course to go through the medical evaluation, no individualized evaluation, and a presumption basically of guilt with no due process. So there's all sorts of changes that are coming. There's policy being made up. There's new ways to push people out of service. The concept even of administrative leave was brand new for the military, just for these people, where when the judge questioned the government in one of the cases, they said, if these people are such a problem, who are they? And the response was, we don't know. We're going to have to go through medical records to find them.
Wow. That's it. I hadn't quite realized the medical thing was how they tried to, so to speak, navigate the legal situation, I guess. A medical condition that, as you say, they required people to assert to get treatment, right?
Correct.
Yeah. So what's happening? I mean, you've mentioned you're on administrative leave. I think you're maybe the most high-ranking person, or one of the most high-ranking, who's been identified, at least as being purged here from the military. But how many of you are there? What are your peers saying? How are they behaving? What's actually going to happen?
I think we're in a period that is really damaging to our national security, because there are thousands of trans service members. One of the things we can point to, though, is we don't actually know how many of us there are. The department reported over 4,000, but there's all sorts of different things on medical records that may lead to this. And we were, in fact, prohibited from self-identifying. Just like after Don't Ask, Don't Tell ended, the government said, you can't even identify if you're lesbian, gay, or bisexual, because that's a personal and private matter, and maybe it'll be used against you in the future. But it was a challenge for us along the way, because whenever we said, here's how we can make policy better, people are facing negative outcomes, or there's an administrative burden on commanders or doctors for executing this policy, we would get asked, show me the data. And I would say, I can't. I can only give you anecdotes. And so we wanted to be able to be counted, but haven't been able to. In any case, it's thousands. There's no perfect estimate. A lot of studies in the past have said around 15,000. Could be more or less than that, but that's a reasonable number to think of. As for what's happening, many of us are on administrative leave, like I am, waiting final separation or retirement. There are others that are going through this involuntary process where basically they're saying, hey, government, come find me. And they have to do that digging through medical records or during an annual review. And in some cases, commanders are basically authorized to go looking for these people. If you find someone who said something on social media, or if someone you believe exhibits the symptoms consistent with gender dysphoria, you can point them out and direct them to a medical evaluation to get identified. And I think that's particularly dangerous, because that opens up a lot of charges against women in particular. If you don't think this woman fits the definition, the classic definition of femininity, well, maybe she's a man, and you need to figure that out. Maybe she's a trans person. I think it's dangerous to unit cohesion, honestly, when people are on the lookout for others. And it perpetuates some really damaging stereotypes across the board of who trans people are, who people in the military are, and it's frightening, honestly.
And the relevant people in command, or they feel they just have to go along, or they go along kind of grudgingly, or some don't go along? I'm just curious how that works.
I can't speculate as to like any individual's motivation, but I can imagine a lot of people are just stuck in a really difficult place where you now have the Supreme Court saying, go ahead and implement this policy, government, while the lower courts, well, the appellate court, and then eventually the Supreme Court take a look at this policy. So there's nothing explicit out there saying what's being done is illegal.
Right.
Is it Is it immoral? Is it in a gray zone? Should senior leaders stand up for people who they know have served with distinction for decades in many cases? I would hope so, but they're in an incredibly difficult spot, and you wonder if it's really that parable about the frog in the boiling pot, where I think, well, we'll just stay. If something really bad happens, then we'll act. But what is the next act? What is the thing that actually gets you to move when those negative things happen? So right now we're seeing thousands of people departing, and it's sad, and it makes me worry who's going to stick around because the effect is far broader than on us. It's on prospective service members who may think, with 30% of them under 25 being members of the LGBTQ community, do I want to serve? How does it affect the people currently in who served with us and now see a hole in their unit where an incredibly competent person used to be, and they've got to work twice as hard? Do they stick around?
The effect, of course, goes way beyond the military. We've discussed this a bit when we talked before. That I mean, I think so. Say you follow this closely. I mean, just say a word. People don't, I think, appreciate honestly. And I'm not. I tried to follow this a bit, but I didn't until a few conversations. How broad the assault on trans folks is, and sort of across the board almost, and how intrusively broad. It's not that, they're military special, they have special needs, it's too much of a burden, it costs whatever they want to say, costs too much, unit cohesion. But we're way beyond that with this administration.
It is incredibly wide-ranging. Recent reporting was just about DOJ subpoenaing the records from hospitals across the nation about every trans person under the age of 19 that accessed care. Healthcare has been taken out of the federal employees' healthcare benefits package and replaced with faith-based conversion therapy. There are assaults on trans people in public existence everywhere. Passports taken away, and court cases challenging that, in some cases putting it on pause, with a number of different actions going after primarily our healthcare, and then also just our ability to exist in public, with laws criminalizing us across the states. And the federal government moving in that direction to really put a chilling effect, particularly on hospitals and doctors and insurance companies, to even be able to provide the care that we need, which is simply health care. It is the same sort of care that millions of other Americans receive under those plans. And it is that which allows us to live authentically.
And a lot of this is directed at adults, not at children who are transitioning or exploring the possibility of transitioning. And I'm struck by that also, and like going to the VA, which presumably has records of people who served in the past. I mean, right?
Yeah, there was a great piece of VA data that actually came out about a decade ago that found that trans people served at twice the rate of other Americans. They looked at the data and said, wow, based on all of this, you serve at a really high rate. And now I've heard from several people that DOJ actually reviewed all VA data and went on a search for all people who had had their records changed within the VA system. VA is denying care at a pretty wide range. No one new can access that care. And it's incredibly challenging for these veterans who have served their country to figure out, well, where do I get my health care now?
So is that right? So if let's assume you are separated at the end of the year, and you show up at the VA, you can't get, so far, it may be the case that you wouldn't get the same
I'm
health
not
care that
sure.
all your peers who joined in 2003 and are now out to get.
What I understand is literally right now is that if you are currently receiving a medication, you should be able to continue receiving that. But will that be the case? Because as they roll back piece after piece, that is likely next. And there are huge challenges. They've already taken all sorts of other benefits off the table. It's wild how much there is almost this kick on the way out the door. In fact, we were in the military denied the opportunity to do skill bridge on our way out, which is how the DoD provides an opportunity for service members to learn and basically intern at another company. And it said this is specifically denied for trans folks. So it is every day something new that shows up and says that we're the problem. And that's really hard. I mean, I'm okay right now, but there are so many others that do not have the resources and the ability that I have to operate in the world, and they are scared and they are fleeing. We, in fact, saw starting quite a while ago a move within the states to help people find care in a state that they can access it. Now it's outside the nation, and people are leaving in droves. And that's frightening because it extends again beyond trans people. We have all sorts of people who are having their research cut, whether that's for cancer research or something else that is going to help us prosper 5, 10, 20 years down the road. They're taking their talent to Canada or to Europe or to Australia. And where is that going to leave us as we build this hole that we're going to have to dig out of?
Yeah, and it was an item recently that I couldn't quite follow it, but it was people who I don't know, served 15 to 18 years or something like that, and who had thought they would have the opportunity to retire, being denied benefits. It's just a kind of cruelty is the point example, though, right? Where there's they're leaving. I mean, that wasn't the issue.
Right.
The issue is
these folks were on their way out the door. They had approved retirement orders under the authority that Congress had given to the service to say those people with more than 15 years of service, if they were forced out in this way, were able to access this program and get retirement benefits rather than separation pay. And so they had orders in hand, and a new person came into a role, political appointee, and said, sorry, that was an error. You all no longer get that. You can either take involuntary or voluntary separation and be on your way. And even though they're offering this separation pay to some of those individuals, should those people ever access VA care, that money is actually recouped. So it's a loan, not actually a payment to these individuals for, again, this could be 17 and a half years of service, and you're just being shown the door with the equivalent of nothing.
Let me ask kind of a stupid question, I suppose, but what is behind this, honestly? That is to say, it seems to me in the past, and I'll say this as someone who wasn't much involved, honestly, in these debates, but was open to the argument that there were unit cohesion issues with women at first, women in combat, and then, as you say, gays and lesbians and others. But we're way beyond that in the sense, I mean, okay, fine. So not fine, but I mean, I guess I'm just, what is behind we're now way beyond an issue of military necessity or military utility or administrative burden or all the things that maybe one could have used to justify policies, or just tradition, since at this point it's not the tradition's the other way now, right? You've dealt with, you've debated some of these people. I suppose you've seen some of them somewhat up close, or seen their arguments certainly more than most of us have. What is behind this, honestly?
Well, when we kind of first faced some of these questions in 2016, I figured we were the last boogeyman. We were the last and smallest group of people that a lot of people just didn't know.
Right.
And you could easily demonize this small, quite politically powerless group and say they're the problem because people didn't know any better. They didn't know a trans person. And now, as we have more and more people out, I think that argument still holds some weight because we are still maybe 1% of the population. But even that's 3 million of us or so. You take that as this group that can be easily attacked. And again, I won't speculate on what is in the mind of any given individual, but I think there are two basic arguments. One is that there is some deep fear or concern or hatred of us that is often based in a religion or something someone believes that we're the problem and are somehow impacting you by existing. And if people see us, or we talk to your kids, or they read a book about trans people, or see us on TV, we're going to cast a spell on you, and that new kid is going to be trans. Like, I wish that power would be amazing, but we don't have it. We are simply reaching for our best selves. On the other hand, there's probably a pretty significant group, a group with a lot more power that has the ability to use us as a distraction to something else, because you can say, look at them, they are the problem. And so focus there while we do these other things that help us be even more powerful. And in between are the millions of people that are buying that because, again, they haven't met us. I believe firmly that if I have the opportunity to sit down over a cup of coffee or watch a football game or something with someone and convince them of my humanity, your opinion may change, because we probably have something in common. We probably have something we like or can share and talk about. And you'll realize I don't have a second head growing out of my shoulder. I'm probably not a monster. My kids may disagree, but most of the time I'm not. And that's what we're up against is this view that we are the problem. We are going to cause more problems. We are going to hurt others. We are going to take from people, rather than we're simply trying to be the best version of ourselves that we can be. And I think that is a fundamentally American act, is that we are on that journey for life, liberty, and the pursuit of happiness. And we hope everyone has that opportunity.
Yeah, I guess what strikes me is, and this is depressing, is that what might have been ignorance, a decade ago, and certainly was in many, many, many people's case, they just didn't know people and so forth, or didn't know that they knew people, probably more accurately. I mean, it's 10 years, it's a long time now, right? I mean, and people have been alerted to the issue and to the existence of people and to the fact that they were serving not just in the military, but many, many other places and living their lives. And now the hatred is just, I don't know, unnerving, I've got to say, for me. I mean, it seems much more, I'm afraid it slid more towards the hatred side of things than the ignorant side of things. And that must have, whatever the psychological and sociological roots of that. And then, of course, it gets, the flames get fanned by a president of the United States and his top people. And what could be, what once might have been unfortunate examples of isolated examples of hatred in different parts of society or in different areas, perhaps regions that are less exposed and so forth, becomes a kind of national thing. And again, the failure to stand up against it, I guess I am also, well, tell me, I'll close by letting you talk about that. I mean, you've gotten, I'm sure, much support and encouragement. Maybe you've gotten less than you hoped at different times. What's your sense of that? It does feel to me like this is a case where whatever one's views on some of the, I don't know, quote, complicated, maybe they aren't, cases of high school sports or whatever. I mean, when it's pure animus, I guess I feel like the country should be standing up more against that, but maybe they are, and I'm just not seeing it. I don't know.
I'm honestly worried about the chilling effect that has occurred on our speech, on all of us. In fact, I receive quite a few messages from people that are like, I wish I could like or share what you're saying online, but I might lose my job. I don't think that I can speak out. And that, I think, is one of the things we really need to be frightened about, is the chill on our First Amendment rights. But what I can relate is that I'm hopeful. Maybe not for the now, maybe not for 3 years from now, but for 20 years from now. And in my last couple of months at the Pentagon, it was incredible that at least once a day, someone would stop me in the hallway, many times wearing uniform, sometimes not, and they would say some version of, I see you, I know you, keep fighting the good fight. And in some cases, I love you. It would be a fist bump, a hug, a high five, whatever it was. And I think that attitude is actually pretty prevalent. It's just people don't know how they can speak out, if they can speak out, and they're worried about, what the repercussions are going to be, because most of us operate from that sense of, look, I've got to keep putting food on the table for myself, for my family. I have to think about that first. But we have to worry about the big picture, about who we are as Americans and where we can be. But why I'm so hopeful is not just that from my peers and colleagues, but what I see with my kids and what I see with their generation, and how these issues which are being used to divide us are a non-issue. I mean, they are nothing to the kids. They talk about stuff like this at school and they wonder, why are the adults so nutty about this? What is the big deal? I have friends that are queer, that are trans, and I love them. They're wonderful. So I'm really hopeful that it's their generation that's going to take us to a much better place, but only if we allow them to get there. Because if trans people are completely forced out of public existence, if the choice is flee or stay, that's tough. And I've had that question asked. In fact, just last year before the election, I met my mom for a 2-day vacation. We're sitting at a park bench overlooking the ocean in Maine, and she asked, "What's your plan to leave?" And I say, "No, Mom, my only choice is to stay here and fight so that my kids have a chance." Because she was reflecting on my family's history. My grandfather fled Germany in 1936 through a lucky break and a chance connection years earlier with an American diplomat that allowed them to get out in the middle of the night through a train to Paris in a brief window because of the Berlin Olympics occurring. And this was literally right after they had seen naked people hung outside their store, saying, "This is what happens when you pollute the Aryan race." And so she sees that and says, "We wouldn't be here if your family hadn't fled. So are you going to leave?" Mom, this is my country too, and it's worth fighting for.
Terrible to have that question asked in the United States, though. Really, just last thing, just if people want to help, if they want themselves help or guidance, or to share a story or to ask counsel, I don't want you to give away your private email, but I mean, is there a group you're involved in that would be appropriate for people to get in touch with?
There's actually a coalition of groups that are supporting the trans service members and the lawsuits. And so there's a website, transmilitaryrights.org, that lists all those organizations and some resources for transgender service members. I think that's incredibly important. And you can certainly find me at my website, breefram.com.
No, thanks. That's good to, I think, useful for people to know. Well, look, Bree, thank you so much for taking the time, and it's such a cliche, but really thank you for your service, honestly.
I appreciate the conversation. It truly has been an honor to serve this nation and to wear the flag on my shoulder for over 20 years.
And thank you all for joining us on Bulwark on Sunday.